second session of a course called Climate and Health Responder Course for Latin America. We had our first session on Tuesday and we had almost 1,000 people joining the course live. We have a dynamic and diverse group and we're very happy to have all of you here today in this course we're starting this week. The course has been organized through the cooperation of Columbia University, the Global Consortium on Climate and Health Education, the IAI, the Inter-American Institute for Global Change, and PAHO, the Pan-American Health Organization. I am Dr. Ana Stuart Ibarra. I'm the Science Director at the IAI. And it's a pleasure to support this initiative, which is so important for the region. I would like to remind you that at the bottom of the screen, you can choose the language you want to listen to. There's Spanish and English. You can click on the interpretation button. Although the presentation will be made mainly in Spanish and all the sessions will be mainly in Spanish, you can listen to the English version. This is a 5-week course. We will be meeting every Tuesday and Thursday for 5 weeks. On Tuesday, we had the first session, which was an excellent presentation made by Dr. Gilma Mantilla on climate change and health. Dr. Mantilla presented some fundamental basic concepts that will help us throughout the course. Today, we will have the presentation made by Dr. Mercy Borbor on vulnerability and climate risks. And here you can see the topics of the other meetings. You can also access the course website where you can find more information. We have a group of experts from Latin America. They have vast experience in working on issues related to climate and health. It is an honor to be able to work with this group and to invite these experts that can share their experience with all of us. Regarding the logistics, I'd like to remind you that each session lasts for 90 minutes. We will have a 60-minute content session as presented by the expert, and then we will devote 30 minutes to questions and answers. This will be a moderated session. Please include your questions in the Q&A section on Zoom. Several people will be monitoring the chat and the Q&A section so that we can ask the questions to the presenter. The main language is Spanish, but we do have simultaneous interpreting into English. All the sessions will be recorded and posted on the course website within 12 hours. And they remain available there. The slides will also be posted on the course website. The suggested readings as suggested by each expert are available before each class. Please make sure you read this material before each class. This is a course website. If you access the website, you will find all the materials that correspond to Tuesday's session and also the materials for today. Today, I have the honor of introducing Dr. Mercy Borbor. She's a dear friend, a colleague, a mentor, and has been so for 15 years. Dr. Mercy Borbor is an oceanographer with a PhD in environmental science, awarded from the State University of New York. She's a professor at the Escuela Superior Politécnica Litoral in Ecuador. She's a senior researcher at the International Pacific Center for Disaster Risk Reduction. Mercy has been a researcher and public official involved in decision-making processes at the local, regional, and national levels in the areas of environmental management and climate change. She served as chief of environmental control of Guayaquil, Ecuador. She was provincial director of disaster risk management for Guayas and deputy minister of the Ministry of the Environment of Ecuador. She has actively participated in the development of public policies on adaptation to climate change and their implementation at the local level. Her research is transdisciplinary with a focus on socio-ecological systems, spatio-temporal analysis for her studies of climate variability and vulnerability, coastal urban systems, with an emphasis on the interaction of climate and human health and climate risk reduction. Mercy is lead author at the sixth assessment report of the IPCC at the Mitigation Working Group. This is group number 3. And she is a member of the Human Resources Group for Climate Services at the World Meteorological Organization. Okay, I will stop sharing my screen now, and I would like to give the floor to Dr. Borbor. Mercy, welcome. You have the floor. Good morning, everyone. It is truly an honor to be here with you today. I am addressing the whole of Latin America and the Caribbean and hopefully other regions as well. Today, I would like to focus on the experience we have from Ecuador and Latin America regarding the vulnerability studies conducted. As has been said, I am Mercy Borbor, and this is a huge opportunity to share what we have been working on in South America. Which are the learning objectives of this session? This has to do with some basic concepts, for instance, disaster risk within the context of climate change, also vulnerability, and some of the intrinsic factors that have to do with, for instance, human health. We will also identify the social environmental determinants, health determinants that we need to consider during research and during operations as well. And we will try to provide examples of some case studies regarding vulnerability and risk. Let us now go to the first poll question. Please tell us which you consider is the greatest greatest threat to our region. Here we have some options, so I would like you to select which you think is the greatest global threat for our region.
Solamente pueden escoger una. Así que no sé.
You can only choose one option. This might take some time. Let's see. It's very interesting to see what you believe or feel is the greatest threat to our region. Okay, I think the results are in. Climate change is the option, the most popular option. Then we have social inequality and also a social issue that has to do with job crisis and livelihoods. After that, we have infectious diseases, mental health, the COVID-19 pandemic, and no one has voted for cybersecurity as an issue. Well, then we know that climate change is considered as one of the main threats of our times. And in this context, in 2020, we had a few events throughout the Americas. We had a drought in Mexico, we had hurricanes, we ran out of Greek letters to name them. We have floods in Ecuador, Colombia, several places in the Caribbean as well, and in the north of South America. We had heat waves in several places with extreme temperatures that we never seen before, such as in Bolivia. We had a large number of wildfires in Brazil as well. At the same time, we had the pandemic. So it is clear that these threats or climate hazards are not something that happens from time to time. They are now more frequent. Also, and regarding temperatures, we have had the highest temperatures recorded since 1850, and we have had as well over 170,000 people die, and over $186 billion have been worth of infrastructure has been lost. Now let us talk about the main messages of the main report of the IPCC. Because of climate change, the frequency and intensity of several extreme climate and meteorological events is increasing. Also, in cities, some climate change impacts can increase, such as floodings, heavy rainfall, the increase in temperature, and the rise in sea levels. Let us try and remember this context regarding climate change. Let us think about these concepts that have to do with climate risk. This includes 3 dimensions: the hazard or threat, with these natural and anthropic dangers. There is also exposure and vulnerability as determined by social, political, and economic processes that have to do with how us as countries develop and what our political and governance systems are like. So we will address this topic as well. Finally, in this view of macro concepts, we need to remember that there is also the Sendai framework as proposed by the United Nations. It is a voluntary non-binding agreement which aims to reduce losses in lives, livelihoods, and health. It states that we should increase information and risk assessment of disasters based on people by 2030. We need this information. There is a specific proposal which aims to increase the availability of early warning systems of multiple threats.
También puede ser utilizado.
These systems or these efforts should also be applied to other type of weather or non-weather related threats.
Dos marcos globales.
Therefore, we have 2 global frameworks: climate change and the also threat concept following the Sendai framework.
Desastre con un marco todavía.
How do we adapt this within a larger framework of sustainable development?
Están totalmente relacionados de las acciones que tengamos.
SDGs are connected to our actions regarding the Paris Agreement and also the Sendai framework when it comes to reducing disaster risk. Why? Because disasters are the consequence of adverse events
en la vida de una comunidad o de nuestra sociedad.
that seriously disrupt the life of a community or society. They can result in massive losses of lives, infrastructure, and affect people's welfare, safety, health, and livelihoods. Some impacts are immediate, and others are caused by the way people react to the situation and try to recover from it in the long term. So disasters are not natural at all. They are a social construct. Therefore, this risk that is based on 3 pillars, the weather or non-weather related threat, exposure, and vulnerability, encompass all these social and environmental issues we live by. Definitions: what is a danger or a climate threat in this case? IPCC 2014, the potential occurrence of a physical event or tendency of natural or man-made origin, or a physical impact that can cause loss of lives, injury, or other negative effects on health, as well as property damage and loss, also damage of infrastructure, livelihoods, healthcare services, environmental services, ecosystems, and resources. So this basically affects the entire society. By way of example, this has to do with heat and human health, urban heat and comfort, heat and productivity, and this also affects the economic side of things, and also floods, which cause problems in cities, property losses as well, and landslides as well, that have affected many areas of South America, the Caribbean, and Central America, which can actually result in loss of lives, as in Peru in 2020. And of course, in Ecuador, we have recurrent floods every year. But it's not just these threats or climate threats that we know. There are also biological hazards that many times go unidentified, but some are clearly defined, and these are vector-borne diseases that are seasonal, and that is related to meteorological issues such as precipitation, temperature, humidity. For instance, we have dengue fever, Zika. Dengue is endemic in many areas of South America. But the thing is that now it appears in new areas. In Argentina, for instance, we had 40,000 cases in 2020. In Paraguay, over 200,000 cases. In an area where the disease didn't exist, health systems are not ready because they don't know the disease, so they don't know how to respond. We also have other diseases. Of course, the pandemic that took over the world, basically, and Zika in 2016 had a major impact in the entire continent of South America and in some countries in particular. But there are other factors we many times overlook. For instance, something we forget, these harmful algal blooms. In 2015, 2016, we had these events from Canada to the south of Chile. We had red tides, as they're called, and they impact, of course, animals and the consumption of seafood, but it also affects some peoples because of the toxins these algae have. Have a look at these brief overview of the hazards and threats and their effects on health, on human health. Each type of hazard or threat, such as floods, landslides, droughts, heat waves, they have an impact on health, people's health, on some diseases as well, but they also affect infrastructure in the long term. Regarding diseases, this potential risk is present after any major natural disaster. Of course, this is made worse when there is overcrowding and a porous and health situation. The thing is, these threats exist, of course, but there is an environment, a social environment that actually makes them worse. Let us have a look at the definition of vulnerability. I will try to combine these definitions from a climate change perspective, but also from a disaster risk reduction perspective, so that we can see the synergies. Vulnerability, propensity or predisposition to be affected negatively. Vulnerability includes a variety of concepts and elements that include the sensitivity or susceptibility to damage and the lack of adaptive capacity. Also, and according to the United Nations Office for Disaster Risk Reduction, we also say that the characteristics and circumstances of a community system or to the harmful effects of a threat. So what these communities are like, and this will depend on physical, social, economic, and social factors.
And now we're going to define this climate risk with the definition we already saw, but we're going to try to make it operational. How do I bring this down to earth when there is something happens in my city, in my community? Well, the definition is here. Risk is basically a function of a hazard or climate threat, exposure that you have, and the specific vulnerability. We have seen that there are political, social, and environmental factors that are in play. I'm going to discuss something that happened in Duran, in Ecuador. We have, in order to make decisions with municipal governments, we have incorporated exposure, sensitivity, and adaptive capacity to have a better idea, to better know the things that depend on people, but also depend on other factors that have to do with exposure. So we're going to see how we do that, but to understand the definition of this climate risk of disaster, we see that it's a combination of the likelihood that an event will happen and its negative consequences. So probability, likelihood is a mathematical concept, but we also have climate change as the possible consequences in situations in which something of value is at risk and have an uncertain outcome. The risk is a result of the interaction of vulnerability, exposure, and hazard, as we saw in the previous slide. So let's see what is exposure. Exposure is defined as the presence of people, livelihoods, species or ecosystems, functions, services and environmental resources, infrastructure, economical assets, or social or cultural assets in places and environments that could be negatively affected. We see here that we have houses that are exposed to different processes that can be easily affected by anything that happens here in the coast. If there were no houses exposed here, then we wouldn't have a vulnerable area here. So the presence of human beings in a specific location make it so that there is an exposure. But vulnerability together with exposure are at the center of the issue. Throughout our region in Latin America and the Caribbean, inequality and systemic poverty are clearly defined as an issue that is at the root of this vulnerability. It has to do with these non-climate factors that are the consequence of multidimensional processes. And the IPCC says that a lot of information and analysis have reached the same conclusion. So we have a high confidence on this. Something that we want you to take into account is that vulnerability is not static, it's dynamic. It's a function of time and space. So when you do a vulnerability analysis, you need to take those things into account. The scale of my analysis system, it's not the same in a rural area, in a city, and also if a risk is seasonal, it's a decade-long process. So we need to take those two things into account. And finally, the last concept that I wanted to define, this is also a picture from Duran where we work, and this concept is resilience. And it's the ability of a social and ecological system to cope with a hazardous event or disturbance, responding by reorganizing itself in a way that it maintains its essential function, identity, and structure while maintaining the capacity to adapt, learn, and transform. So these resilience processes are the ones that we want to see happening throughout our region. And I would also add the idea of resilience as a systemic issue, because we need to take all of these multidimensional factors into account. And with this, we're going to see the next poll that you can see, should see on your screen. And what do you consider is the most recurrent climate hazard or threat in your region, in your location? Is it floods? Is it droughts, heat waves, frost, hails, landslides, the rising sea levels and coastal erosion, hurricanes, vector-borne disease, epidemics, plagues? So let's see what you think is the biggest threat, the most recurrent threat. Let's wait for all of you to answer so that we have an idea of how we see these things. So first, with 35%, we have floods. Then we have droughts, then heat waves, landslide before heat waves, and also vector-borne diseases. Finally, frosts and hails and hurricanes. Perhaps we don't have a lot of people from the Caribbean right now, so not many people answered that, but it's something interesting to look at. Before going into our case study, I would like to discuss some important things. The role of local governments on disasters. UN Habitat recognizes that cities are the first line of preparedness before not only faced with the COVID pandemic, but before that. And it's important to cooperate and coordinate with national health authorities. National governments are always providing surveillance, especially during the pandemic. We saw that, but in a lot of territories, the local governments are the ones that have the structure to assess the situation and take the corresponding measures. So I need to have a monitoring and information system, and local governments are the ones that need to make informed decisions, basically because it's part of their competencies in using the land, provision of basic services, managing disaster risks, the provision of food that is within their territory, as well as vulnerable groups. And this is all connected to sustainable development goals. Now we are finally going into our case. I'm going to tell you a little bit about what we have been working on for around 4 years. Duran is a satellite city near Guayaquil. It's an intermediate sized city, like many in Latin America, and it's on a coast. This is the location on the river, and this is the configuration that has been based on an ecosystem that mainly consisted in lower areas with floods. And so that ecosystem is still there. And when you see these purple and green lines, those are some artificial or natural channels that some are being closed, some are still there. So we have floods, heavy rainfall, heat waves. Right now, today I'm only going to discuss floods because of our time constraints, but you can see that we have other issues. And this is the system that we used to work with the city. The goal was to increase resilience and adaptation measures faced with climate change. So we did a threat analysis, floods, heat waves, and we did a detailed analysis of vulnerability and risk. We use technological platform for the integration. And so then we came up with strategies in conversations with the key stakeholders of the city. So we have some measures that have to do with governance, others that have to do with urban planning, and others with data and information generation. As for the threats, each of the threats, floods, landslides, and heat waves require specific work. We need professionals from each of these areas, hydrologists and meteorologists for floods, and also people working on geography and geology, people who need to talk with decision makers to be able to map what they have seen in their territories. For landslide, we need to work with people who work in geology and to be able to map all of these risky areas. And for heat waves, we needed temperature sensors, meteorologists, and to be able to map the places that had the higher risks. And so now we're going to go into vulnerability. And why is this important? Because we need to identify the factors that make the population more exposed, more vulnerable, and that makes it so they have a lower ability to respond and recover. And after what? After what's what? We can understand the strategies and measures to reduce the vulnerability and the exposure and increase our adaptive capacity. We took this pathway, identifying the levels of exposure, susceptibility, and adaptive capacity, and we integrated this in an analysis and mapping the vulnerability on some specific areas such as city infrastructure, healthcare, and livelihoods. So we're going to discuss health very briefly, not all of those, but those are the ones we took into account. And then we mapped the climate risk for priority sectors. This has to be an interaction and a work that it's in a constant feedback with specific actors in the communities. And the framework that we had for our flood vulnerability is based on a previous article from Doctors Wilhelm and Hayden from Colorado, colleagues of mine, and it deals with some of the causes that we have for floods. We know that there are some disturbances that are environmental and social. The variability on climate change that disrupt a typical year, whereas climate change is something that is constantly changing. We also have urban growth and population growth. Then we have the exposure, sensitivity, and adaptive capacity. As I was saying, when we look at the causes and the variables that affect these three definitions, these help identify the measures that I can take to deal with each one of those, like maintaining infrastructure, green infrastructure, guidelines that to support governance, and the community-based programs. And depending on the vulnerability, we have different impacts. And we have found that little local information, for example, on the impacts of a flood, what is the cost for government to deal with this situation regarding the public health. So we have, for example, here, biophysical factors, meteorology, the distance to the area where the floods happen, all of these have to do with exposure. As you know, phenomena such as El Niño in the ocean. And then we validate this with people who have firsthand experience from 2015, from 88. So all of these, the sensitivity has to do with demographics and factors that have inherent to people, the economic conditions, the housing conditions, infrastructure, the age. And for adaptive capacity, we have the resources that the city provides in terms of management, community organizing, the education that a city or neighborhood has, the livelihood, and the organization. And for the exposure variable, we're going to see what we did for floods. First, we recorded some variables. We took a lot of variables, and then we brought it down to just a few with statistical techniques to see for which we had the best data. So we looked at the specific ground conditions to see where it's too low, because those lower areas are more prone to floods. We created an index that it basically, when it's 0, it's a low likelihood, it's a low threat. And when it's 1, it's a maximum level of threat. So it ranges from 0 to 1. Then for flood recurrences, it was basically yes or no, whether there was recurrence on a certain point. Then the distance to areas of critical collection, which was the area where certain levels of rainfall could happen. And this one ranges from 0 to 1. Exposure definitely depends on the geographical area of the system where it is. It's not the same in an island, in a city in the Andes, in a deserted area. So we need to take that into account, and we need to find the local knowledge from experts. And in the beginning, we created these exposure maps that have to do with the susceptibility to floods and the information from the municipalities with areas where water was collected. And we have information from municipal governments where floods happened in a certain year, and we compare that with the rainfall information that we had. So we were able to map all of that information at the city level and overlap that with census information. And so we could see, we have the urban area, that was our analysis unit. So the census is helpful, but if the municipality doesn't use the information, we need to look at what the municipal governments use in their day-to-day operation. And finally, what we had was we ranked areas from very low exposure to very high exposure using those indices that I showed you before, from 0 to 1. 0 being no exposure and 1 being high exposure. And so we were able to come up with this map. And
in the case of susceptibility, let us now have a look at the sensitivity variables regarding floods. These are the variables we use. They are not the only ones or the ones that apply to every case. They worked for us. We had many variables, but we decided to conduct a statistical reduction. For instance, population density, population with a disability, people under 14 years of age and people older than 65 because they are especially vulnerable. Also, the illiteracy rates and pre-existing conditions. This part is difficult because there isn't a dialogue between local offices and local authorities and health offices. So we don't know whether people are I don't know, people with diabetes or some sort of disability. Or maybe they have chronic kidney disease or whatever. It's very difficult to access this information. In the case of housing and city services, here we have, for instance, housing material, which is critical, access to housing, how you reach the housing units, overcrowding as well, which is very important. And if the population is more susceptible, the range of susceptibility is measured according to 0 and 1. Also regarding sanitation, no access to electricity, no access to drinking water, no access to sewage, or no garbage collection system. These factors increase susceptibility and therefore vulnerability. Let us have a look at this geographic perspective. And this happens in many cities. Here we have, for instance, children under 14, people over 64 years of age. Let us have a look at map E. The area in dark color is where we have young kids and young people. And have a look at the F diagram. They are located in another area. These areas are newly developed. They're usually informal settlements where we can find young families with young children, whereas more elderly people live in more consolidated areas. This is a center of the city where there are very different living conditions. This will also depend on the socio-political context of each city. This is why it's so important to determine this, because when it comes to developing special programs, I need to know where elderly people are and where children and young people are. When we mapped susceptibility or sensitivity, this is what we found. First of all, we identified the sectors, and this is very interesting. When we study the statistical side of things and they ask us about the most important factors, living conditions are the most important ones, then access to housing, and number 3, lack of basic services. These are the 3 indicators that directly affect this susceptibility factor. And susceptibility was essential regarding vulnerability. In these sectors, how I look at the conditions these young families and children are living in. They have limited sanitation, they're exposed to several hazards and of course diseases. In these areas, people have, several services, but so there are other types of vulnerability. For instance, a sewage system that is overloaded, blocked draining or limited draining system, and this makes cities much more vulnerable. Have a look at these areas. These are informal settlement areas. The final variable that has to do with human resources within societies. For instance, we studied, the indicator was human capital. We studied the educational level of the population, social security or welfare available, type of activity as well. And this has to do with defense and health, because some people might have a greater capacity to react or to respond to an event. There is also a major variable that has to do with the distance to public services, such as health clinics or centers. We also included the information, an information variable. And in another project, we noticed that we think that everyone has access to information, and that's just not true. So sometimes you have this distorted view because you think that having a mobile phone is enough to access information. It's not. Also, neighborhood leaders. This is very important regarding how the community organizes itself. These were the prevailing variables: lack of health services, lack of social welfare, and also limited community organization. These were the three main variables in this case. Have a look at this area in red. This is a semi-rural, peri-urban area which lacks, welfare services, public services, and the community is not organized. So they are a highly vulnerable area, and we need to do something about it. Have a look at this picture, which provides us an example of resilience. This is a family living in an informal settlement in poor housing. But have a look at the plants and how green they are. This points to the need of having a healthy environment. These are maybe herbs. And have a look at these people's voices. Have a look at the message they're posting. This is what they want to tell the authorities. And everything that is mapped here, have a look at the dots. These are informal settlements. Almost 44% of the city is based on informal settlements, such as the ones you can see in the pictures. Do you remember the children? This is where the children are. This is where their families are. So this shows us that we need to set up specific resilience processes. So what we do basically is add up all these variables: exposure, vulnerability, including adaptive capacity and sensitivity, and we obtain a resulting map that shows us the most vulnerable areas. We can conduct a more specific analysis of the territory. Here we have three types of maps, two types of maps and a picture of what really happens. So it's very important, to leave our offices, our academic offices or national offices, and go to the sites and see what's happening. Of course, this is very time consuming, but it's very important in order to implement these co-production policies. And also because the community knows things that we can't see, and they can provide you with information. You can get feedback from this map in order to include data that can only be recovered in the territory. When we conduct this vulnerability analysis, it's very important to consider the scales as well. So if we did this at city level, it's important to know, work with a spoken map and to think about these main threats from a community perspective and to think about the impacts they consider. Many times health is not the main impact they focus on. They focus on livelihoods especially, and sometimes on infrastructure. And of course, moms are usually the ones that consider health the most. There is also the issue of threats and local experience and memory. This is very important to explore. We need to make the most of this knowledge. For instance, in 2015, we had an El Nino event. And they can tell you that, I don't know, this happened, the water rose to this level. So we can document information that can be used scientifically, and we can, I don't know, look up the the rigorous data, for instance, what was the precipitation level, what about the precipitation level in millimeters, etc. What happens with the floods? And this helps the community as well. Sometimes they are there, but they don't know who needs things. They might need specific treatments or medications at the time of a flood that might not be so serious, but people might still need the medication. Leaders are essential. It is very important to identify leaders and to determine their roles regarding community brigades, health brigades, environmental promotion, health brigades. Young people are very much interested in this. And here we have poll number 3.
¿Considera usted tiene mayor influencia en la
Which indicator has the most impact on vulnerability in your communities? And here we have the options.
Acceso a servicios de la salud, falta de empoderamiento de la comunidad.
Informal settlements, lack of basic services, education, access to health services, lack of community empowerment, limited communication and coordination with the authorities, and limited inclusion of children, elderly people, and other priority groups.
Que es un factor importante en los temas de vulnerabilidad.
Please select the most important option according to your experience.
Y luego me dicen cómo andamos con el tiempo. Muy bien. Entonces, definitivamente, miren ustedes, asentamientos informales, 36%.
Great. So settlement, informal settlements, 36%, basic services, number 2, then education, limited coordination, lack of community empowerment, limited access to health services,
Personas más vulnerables. ¿Eh?
limited inclusion of children and elderly people. It's very important to know about what we think about what happens in each territory.
Ok. Hemos mapeado la vulnerabilidad y yo les mostré lo que habíamos hecho.
So we have mapped vulnerability.
Y entonces, a partir de eso, ¿qué estamos haciendo ahora? Estamos trabajando en planes de reducción de
So what
riesgo.
are we doing now? We are working on risk reduction plans, some for the city, for canals, for instance. We need to build green infrastructure in order to make these areas resilient. Of course, there are mangroves, which are natural barriers. Channels are natural barriers as well. And many times we don't include them in our planning. So we need to develop risk reduction plans. We haven't talked about urban planning yet, but of course this should be included as well. Multi-hazard early warning systems are the focus of our work as well, because if we know we will have events, we need to prepare our communities, our populations, so that they can, of course, save themselves, but also protect their property and also reduce these impacts. So these early warning systems should be addressed. There is a lot of work to do in the case of floods, heat waves, and epidemics as well. We need to establish resilient plans at the city level. This is essential. By grouping risk reduction groups and climate change areas as well, we can have healthier communities, and we create the necessary areas or spaces to promote well-being and health. Mental health is essential. I'm not sure if it's an epidemic, but we have a large number of mental health issues in our populations. Finally, we should implement specific public health actions or programs. When we started to work with the community, we have detected malnutrition cases that overlap with overweight issues. There are diabetes issues as well that are generalized in many areas of our cities. So we need to work with this type of program. At the community level, we need to organize risk management committees. And we need to tell our community that they need to self-determine so that they can react and walk the resilience path. We need to identify the specific actions that Mrs. Rosita needs or the kids on the corner need when there is a flood, when there is a heat wave. Of course, elderly people get dehydrated and they don't know, and they are dehydrated until it's too late. We also need to prepare the community for resilience, and this is essential. So this is what happens at the city level. Cities have
visiones, diferentes casos, y es importante
different systems, cases, etc. And it's important to study this through data by integrating information as well.
y el conocimiento local.
And we need to integrate local and expert knowledge. An example on the use of maps and health services. Here we have different types of health centers, etc. And have a look at the flooded areas of flood areas. They might also be resilient structures. Some, as these ones, are resilient. Therefore, we need to implement specific plans for these health centers. We have to decide if they are a hospital or whatever in order to make the necessary changes. Have a look at this other map. These are schools. We have schools everywhere. But for instance, regarding heat waves, we need to know if these schools have the necessary ventilation conditions so that children, when it's so hot in our cities, can, feel well. We need to know if they're going to dehydrate, and maybe the intellectual capacity will be affected. We need to address all these issues. Have a look at this chart taken from the work conducted by Anna Stewart that has worked for so many years. This is a visual representation of the complexity of these systemic risks around a disease like dengue, a vector-borne disease. First of all, we have the disease's seasonality. This is a climatological variable. We need to include this variable within the operational processes of health services, also serology level. If we have no diagnosis, and then we cannot conduct the necessary surveillance. Also, housing conditions are essential so that we can see what happens in my cities, what happens with different partnerships. And we also have entomology processes. This has to do with seasonality as well, and how housing conditions can affect this. This is a bag filled with mosquitoes, for instance. These are vulnerable populations that will be the most affected. The map shows us the incidence of dengue throughout the city. This is the city of Mechala. And also, considering all these variables, we need to remember some of the areas that have a higher dengue prevalence in order to take specific actions.
In the case of dengue, we mapped some vector-borne diseases, acute respiratory tract diseases, and what we have found is that in 2015 we had a huge number of cases of dengue. In 2017 we also had an increase, and we can see the same for other diseases that have a relation to weather and sensitivity, with Zika virus as well that have to do with rainfall. Some cardiovascular and respiratory diseases grew with these phenomena such as El Nino, but we are aware of that, but that is not included into the operational parts of healthcare system. And that is something that we need to work on. And something else that I would like to know now is, which do you think are the climate sensitive diseases that need to be researched the most, that we don't know anything about, that we should know more about? And you have vector-borne diseases, temperature sensitive diseases, diseases connected to mental health, and non-infectious diseases, zoonotic diseases, diseases that have to do with ocean toxins, and diseases that have to do with water and how it is handled.
Veamos los resultados.
Let's look at the results. The first one is vector-borne diseases, but we also have mental health high up there. And the last IPCC report precisely included mental health diseases as something that we need to work on more. We need more information. And the pandemic that lasted over 2 years has also shown some light on this need. Also, zoonotic diseases is something that we don't know that much about, and we need information. Diseases connected to ocean toxins in the island communities and coastal areas is something that we need more information on. Chronic diseases as well. So thank you for your input. And now to close this first part and to not just stay with the problems, let's look at our options and our proposal with our view to integrate adaptation to climate change and resilience is that we need to both need to focus on health. And that is something that the WHO is insisting on, and the message isn't reaching who it needs to reach. So for health and wellness, we need to identify factors for health prevention. Of course, we need to do early surveillance. We need systems to detect emerging diseases, and we need to reduce inequality in all aspects. Access to social housing. Cities don't have social housing systems, and people end up living in informal places, and because there are no conditions, there's no provision for that. We also need to empower the population and work on health promotion. Sustainable cities, the goal 11, we have an opportunity working with local governments for strategically create healthy green spaces, sustainable transportation, healthy housing, areas for pedestrians, social areas. We have some places in the city of Guayaquil, we have many schools, and every time I go there, I see the people that have the need to go out, to visit these green areas, to walk around. So we need to work on that. And this isn't just adaptation and resilience, because these areas can have resilient environments, but we are also mitigating climate change. And regarding the areas that are around our places where people settle, they're sometimes wonderful areas, but we don't pay attention to that. We don't see estuaries as areas where we can be in contact with nature. So recovering those ecosystems, including ecosystem services in city planning systems, reducing pollution, access to work on appreciating the biodiversity as well. And just to mention in closing about resilience, the Dr. Carissa Etienne recently said in 2022, to mitigate the impact of pandemics and other public health emergencies, we cannot achieve a sustainable development. So we need a systemic solution. We have some factors for resilience. I'm only going to mention three. Integrating public health in disaster risk scenarios. Even after the pandemic, we are not articulating emergency systems with healthcare systems, with communication, exchanging information, established protocols. Sometimes the work teams, we only sit down to talk at the moment that there's a problem, but we should have scheduled activities to share information. Of course, there are confidentiality issues, but we need to find a mechanism to see these things also that are not so obvious, such as mental health. So working together on risk, disaster risk and public health are things that institutions need to work together. Ministries of health, disaster risk agencies, combining the environment, exchanging information, and strengthen our abilities on for dealing with the epidemiologists. And we need to train the people in the academia, in our operational systems, but also in the community. And we also need to integrate public health and our social capacity, include the most vulnerable groups in preparing prevention and recovery. If they are not included, if they don't know what we are talking about, they're not going to be able to take part in it. So we need to organize the community for resilience. In order to increase resilience, we need to reduce vulnerability. So we need to take a holistic approach involving all of these sectors of society. And with this, I close my presentation, and I hope I have contributed to your knowledge. Thank you. Thank you, Mercy, for your excellent presentation. There has been a lot of discussions in the chat. We're going to select some of the questions to answer in the next 20 minutes. A lot of people are interested in the methodology that you discussed, that you have applied in Duran. Perhaps you can share some documents with information afterwards. What systems did you use for creating the maps? I don't know if you want to share a little bit about that, but perhaps some additional literature that you can add afterwards. I'm so happy that you are interested in this vulnerability work. This is critical work, and it's sometimes taken lightly, but it needs to be taken into account with operative actions. In the link that we provided for the previous materials to read ahead, we have a short version of the methodology in Spanish. We have some of what we did for floods, and we also used it for landslide in a similar way, and also for heat islands. But I think that that works as a guide. We also have an article about the vulnerability framework that we used in the sustainability journal. And I can share that. I don't know if we are going to post it. We can put it in the chat right now, or we can also link it in the website so that everyone can read it. And that one is in English, and it's a bit more scientific. So the document I shared right now is in Spanish, and it was the intended target were the municipal governments. So we have the methodology in going into details, sort of like a protocol, what you need to do in the computer, the kind of information that you need to get from data, how to standardize data, because that's information that sometimes is not available, but you need to know those basic steps to be able to do this. So yes, of course, I can provide this material, this paper in English, and the material that is already with those materials. And something about data. Can you recommend international sources with good resolution that can be used for these kinds of analysis? And also whether you can use satellite information with remote sensors. Yes, completely. The first data source that we used was the Sensara database. And I have seen that other countries use very similar systems to work from data to space. The software is called Reatam, and it allows for me to download the census information for the city or the geographical area for at the block level. So I can have the precise information from the census for an entire block. I'm going to write down the name of the program in the chat. So with that software, we can create the basic layers of information of population density, housing, education, which isn't sometimes entirely up to date. So with the new areas that have new developments, we need to work with the municipal government to see what new areas have been built. For example, because of the pandemic, it happened that in many countries that the 2020 census wasn't done. So we still don't have a data that is updated. The last census we had was from 2010. So there you can see in the chat the sustainability framework for vulnerability. I'm also the first author, so you can find it if you look it using my name. We also spoke at the beginning about the basic concepts and calculating the risk. Can we go back to what part in which part of this analysis do we include the health data, the dengue numbers? Is that part of the vulnerability or is it another component? Yes, that will depend. This is something when I mentioned, I'm going to go back here to pre-existing diseases. This is key. Here we can put the information that we have. For example, if I have the information by district or neighborhood or any geographical unit of the city, we don't always have it at the same level because the census has very fine-grained information, but I can have units in a city and I can put the rate, the case rate. We have this indicator from 0 to 1. We are always going to have some areas that have no dengue, some areas that have a lot. So we don't take this information from the census. It's epidemiological information from the ministries for each geographical area. And this is difficult because for health, we weren't able to use infectious diseases such as dengue. What we did later was a time analysis in this part. The only thing that we were able to do, and I think we could do a lot more work on this, but this is what we were able to do. These are healthcare centers. And so what we were able to find is how many people went there. These are for respiratory diseases. So this more or less, you can see that, but you can see the distortion of information, because here it looks like there's nothing here, but as you remember, these are informal settlements, so there are no healthcare centers. So we have no information about this area. If we go to that territory and then we did some analysis, there's no precision on geographical points. So we need to be a little creative. And what we did was look at how healthcare centers, and to see the ones that have the highest numbers of these disease, the green triangle is vector-borne diseases, in the areas with the highest risk. And we can include that into vulnerability. So you need to be creative and you need to work with what you have got. I don't know if that helps. Thank you. Yes, Mercy. And we have different questions on the role of local governments, because you emphasized that a lot in the response to these threats. And some people ask, what has been the role of government entities during and after the study? Were they actively involved? Did they make any decisions? Did they carry out any actions based on the results? Yes, thank you. It's a very interesting question. This has been kind of like like a ripple effect. You throw a little stone and then there's a little wave and then another one and another one. What we call this project climate resilience for Duran, to learn about the risks. And then we had a second project also working with them to design an early alert system. Then we were able to decide with their own priorities, their needs, and we offered some alternatives. So the thing they were most interested in was to see how we can work on an early alert system. There is no a working early alert system at the city level. We do have that some in Ecuador at community level, but not at the city level. So we are hoping to have one. We have the design and we're going to begin the implementation phase this year. We're going to have sensors. We are going to have a monitoring room, and the community is working on some environmental monitors who are people from the community. First, we did some with some small bottles. They would register, they would record how much rain had fallen, and they would share that information via WhatsApp. And so with these people, what we are trying to do is for the community to collect information and send that to the center. And then we have had other people join, some national and international stakeholders. Our national risk system that started to look at how we work on this, also with the pandemic and everything that happened. And there's also some international food agency also working on this, and we're going to the community right now to strengthen the community's response with specific actions. And the view that we have at the beginning, it was as a response, and we need to stop with the idea of the response to resilience, because if I prepare a brigade, I not only have to teach them first aid, but they need to identify, for example, who has kidney problems and needs some special care. So we are walking on this path. We're going to continue working, and we're trying to document everything because I think this will help motivate other communities.
Thank you, Mercy. There were several questions regarding how we can implement these methodologies and ideas at the national level. How can we implement this in our countries? Our countries are so different and populations are different, geographies are different, threats are different. And how can we apply all this regionally? For instance, someone talked about the mega drought that affected several South American countries. How can we face this? And also, are there national or regional initiatives that can be implemented? At the national level, I believe that we need specific institutions. Climate change is very important, and this institution is essential. Climate change in each country falls within the Ministry of the Environment. Regarding disaster risk, there are several institutions. And of course, there is health. The health component must be included. These are three major institutions, let's say, that should be working together in order to implement these actions nationwide, because they allow us to map the problem. But then this needs to be fine-tuned for the local community, because we start working from, I don't know, nationwide or national level risk data, for instance, but this cannot be applied to each community. We need to work with these macro data from the beginning. We need to have common objectives regarding climate change adaptation and health. And of course, we have the tasks of the Ministry of Health and also the Ministry of the Environment. These alliances will allow us to work in a more efficient way, and then this needs to be developed and also transferred to the local work that needs to be done within the territories. Thank you, Marcy. From your experience, what do you think about the actions needed for capacity building at these various levels? Which would be your main recommendations? Because there are several needs and gaps in local and national or international needs. Of course, yes, we need to train the trainers. That's essential. And we need to work at various levels. First of all, we need to work with these three ministries, maybe include a fourth one, the social ministry as well, in order to include this resilience manage and to convey to different health and environmental people, because then they work with national governments. Also, municipal actions or territorial actions need to be strengthened as well. And that is ongoing work. One of the things that happens in our region is that every 3 years or sometimes more often we have, staff turnover. And it's a problem because there is this knowledge or technical knowledge in a municipality that then is not available anymore. And this is why institutions need to create work protocols so that they are included within their operational procedures through resolutions issued by each ministry in order to articulate this work. If there is no information exchange, I cannot really work, and I cannot identify vulnerable groups. We made a few proposals so that each university throughout the country can become the evaluators of these local institutions, national institutions and national authorities, in order to articulate these health, risk, and climate adaptation factors. Thank you, Mercy. Regarding gender, In your work and the work of others, what has been the role of gender in the analysis? Maybe there are some gaps that require more work, etc. Yes, we need to self-educate from the academia as well. There is the importance of transdisciplinary work. We come from the biophysics community. There are geographers as well. And we need to include social scientists as well, people that know the territory. That is essential. And it's also one of the IPCC recommendations. We are now acknowledging more than ever the work of social sciences. For instance, ethnic groups are essential because they have different cultural components. We have acknowledged their work, but we need to get ready for this. Those of us that work in the area need to get ready to transfer the gender issue to local institutions, for instance, when it comes to managing disaster risk. We find that women participate more often in the area of disasters, and there are many female leaders in these neighborhood committees, and there are many young people as well. And this fills me with hope, because I think that with the work of young people, we're going to really, create agents of change in their territory. Thank you so much, Mercy. We have also almost 900 participants right now. Anything else that you would like to share with them? Yes, governance. I think that's my closing message. Governance. We need to articulate our work. We need to, not focus just on our work. We see this at every level because people, the municipalities, for instance, they want to work within their office without including the social sciences. But the thing is that we need a synergy. We need to work in an integrated manner. This is very important for climate change. Governance is essential. We need to articulate the work of ministries, governments, and the community. That governance at the different levels might be different, so we need to find the necessary mechanisms to, have a conversation. The academia has become, an articulating agent. In some cases, we see that we have worked with people with different political perspectives. We have had two completely different political administrations, and we have been part of two subnational administrations in the same area, and we're still working with them. So governance is essential. Thank you so much, Mercy, for this amazing presentation. Thank you very much to everyone who has participated. We'll meet again on Tuesday. We will resume the course. Please remember to go over the materials before the course on Tuesday. And you can use the same link, and you must use the same link you have used this week. Have a great day, have a great weekend, and we'll see each other again very soon. Thank you, everyone. Thank you.